point cane or simple point cane. Single point cane or simple point cane. So you need a little stability with this one, okay? You need a lot of stability with this one. It's used for full weight bearing, What you need to remember is this is the least stable cane. It is the least stable cane, and it's called the simple or single point cane, okay? Again, you can use this going forward or going back. Sometimes you'll see these in the store like Walmart, Rite Aid, Walgreens, CVS, places like that, and they get real fancy. Some people have them made for them. This is your, typical C cane here. I like to call it my C cane. So same thing, I need to measure it to my wrist. So I'll put this here. Good? Look good? All right. So, again, which side is it going to go on? Non-affected side, correct. So, I don't know if any of you have ever seen that show House. Anybody ever seen House? Okay. When you see him, he's walking with the cane on the affected side. You see him walking like this, right? Yeah. In the hospital. Have you ever seen the show? He had a whole bunch of physical therapists up in arms, writing to Hollywood, execs and so forth, because showing that, people tend to believe whatever they see on TV, and it was causing a lot of problems when they were trying to dispense and teach their patients how to ambulate properly. So you can imagine the uproar that they had. So we're going to do it the right way. So again, your cane is on the opposite side. Why? Because it's giving you the balance for the side that's your weaker side or your affected side. Again, you don't want to go too far out. I've measured it to my wrist. It doesn't matter whether I have it facing forward or facing back. You can also have a little handle here so you can walk around. But when you see people like this and they're going to the store and they're like, oh, I want that over there. You don't need this cane. When you're able to walk around and you're doing this and you're doing the kind of dancing, put the cane away, okay? You'll be on the cane, all right? So, or they forget it. And I'm like, if you forgot your cane, you don't need your cane, right? All right, so, some family members you're going to talk to, huh? Yeah, I know. All right, so, again, what you want to do is you want to walk with your cane and the affected side together. Cane and affected side, okay? Cane and affected side. All right, and so you can lean a little bit, but you have to have some pretty good balance. This is not for somebody who's not weight bearing, definitely. I wouldn't even do it for toe touch weight bearing because I'd have to put too much weight because it starts to give you much stability. Partial weight bearing, possibly could be partial weight bearing or weight bearing is tolerated. You probably could do that, but it really depends on how the patient is progressing in their treatment, in their recovery. Okay, so again, walking with the cane and the affected side together.